in just a couple moments. Oh, there we go. Perfect. Let's keep letting people in here. So welcome. We're excited you're here. If you would like, please feel free to type your, your name, the organization you work for, and where you're located into the chat, and any other information that you want to share with us. We are at 12:31. So I think what we'll do is the first set of slides is for first 5 slides or so are just an introduction. So I think we can go through the introduction and hopefully more people will be joining. Matt, if you want to put up,
I will do that.
Slides, we'll get started. But like I said, feel free to put into the chat your name, your organization, and then where you're tuning in from. Thank you. Somehow I lost my chat there. There we go. Now I'm seeing them. I love to see how many people, where people are from here. So we have Michigan, South Carolina, Idaho, Iowa. And it's okay if you're going to be off camera, no problem. If you can come on camera, that's great. And you can always type questions into the chat, but you can unmute yourself and ask questions as well. Like I said, it'll help to make a more fun and engaging session. So let's jump in. So welcome, like I said, to the first session of our NIATx Virtual Change Leader Academy. You're going to spend the next 90 minutes or so with Matt Rusa and I, and Matt's going to introduce himself in a little bit. So I'm Chris Kelly, and I'm a project manager with the Peer Recovery Center of Excellence and also a person in recovery. Next slide, please. This is just our funding statement to let you know that this is being done through a grant with SAMHSA. All views expressed here are the views of the speakers and not necessarily the official policies of the Department of Health and Human Services. And for the Peer Recovery Center of Excellence, we really focus on 4 core areas. And so we look at the integration of peer recovery specialists. We look at building and strengthening the capacity of our recovery community organizations. We offer trainings that enhance the professionalization of the peer workforce, and also do some work on disseminating toolkits and resources around evidence-based practices. Always important, if we want addiction destigmatized, we need a language that's unified. The words we use matter, and caution needs to be taken, especially when the disorders concerned are heavily stigmatized, such as substance use disorders are. And so we want to always be mindful not to call someone by their disease, their diagnosis, they're a person first. And we always want to honor that and provide dignity and respect in all of our care. A little bit of housekeeping. Again, we love to see your faces. If you can have your camera on, that's great. If you can keep your line muted when you're not speaking, but we will ask you to unmute and ask questions throughout the sessions. And always feel free to use the chat feature. I see a lot of people are signing in, putting in their name, where they're coming from, and their organization. So we can keep that going, and feel free to post questions there. And myself, Cindy, Marissa, Matt, we'll all keep our eyes on the chat and pop in any questions that you might have. And just to note too, as you're coming in, we are recording today's session, and we'll post the recording on the landing page. And maybe while I'm saying that, Marissa or Cindy can put in a link to the landing page into the chat. And from here, I hand it over to Matt. So welcome, Matt. Thank you for being here.
Yeah, thank you, Chris. And as always, when Chris and I have done this together before, we have a nice give and take in terms of the conversations, with me presenting some of the material on process improvement, quality improvement, our NIATx model, and Chris helping me to kind of think about that through the lens of peer support. So we, as this slide indicates, we use this process improvement model for a lot of different kinds of services and supports and a lot of different environments. And so we kind of think about it through a lens of a particular service area. And as we're working with you all, we're talking about peer recovery and peer services. And so as we have the conversation, we will always be looking to use examples from peer recovery and peer support. And we'll look to you to share some of your thoughts and experiences as we talk about different process improvement elements. You might not even be familiar with that phrase, process improvement. What is that? What are we talking about? And we'll talk about that today. We'll do a lot of nuts and bolts around the basic model and what the history is, kind of where this stuff comes from, which will give you a foundation. And then over the next 4 sessions together, we'll teach you some very concrete tools based on that foundation that you can use to improve the services and supports that you deliver. So that's what we'll be about as we spend our time together. This is just a quick intro from me in terms of my background, just so you know where I come from. My background is in clinical social work and agency administration. Also have background doing some teaching and government planning work as well. I currently work full-time as a consultant, and a lot of my work is involved with NIATx and NIATx coaching and training people like what we're doing today, helping people to learn how to use this NIATx model for process improvement. And so I've also been involved with NIATx since it got started. So I've seen this work used in a lot of different environments successfully across all different sorts of services and supports. So I have no doubt that if you learn these tools and work to implement them, that you'll be successful with them, because they're very well tested and they've been very successful in a lot of different environments. We try to keep a pretty common sense approach to things. We want them to be things that you can learn and then use immediately. We want them to be easily shared with your peers or your other staff team members or other folks with whom you're working. If any part of what we're talking about doesn't feel like doesn't feel like something that you could just go do, then we want you to tell us that. We want you to talk with us about any concerns, any kind of yeah, but that doesn't sound like we could use it for this, or I don't think that would apply here. If you have concerns like that, it's important that you share them with us so that we can try to think about that with you. So, but we'll do our best to try to keep them focused. One of the things that I always try to think about is it's not only you all who are here, but you'll then be going and working with other folks who you may want to share this with. And so we want to make this clear so that you can easily do that. We don't want to add a lot of extra burden to the process for you so that you have to do extra reading or preparation or homework to be able to then have conversations about this stuff, because you're busy and you might not be able to have the time to do that stuff. So we try to keep it as clear as we can. So you can help us if you have questions or anything seems a little confusing as we go forward. So I want to kind of give us a little bit of an orientation here, because we want to really encourage process improvement in the peer services environment. So one of the things that we know is a lot of times folks will talk about peer support within a broader array of services without a lot of focus and clarity, without really thinking about the distinct and unique qualities, benefits, power of peer recovery support. So you don't hear this happening. You don't hear people saying, hey, nurse, just go do some nursing stuff. We don't say that to managers, but we're still seeing quite a bit of that kind of stuff related to peer support, because systems haven't evolved enough in their sophistication to really understand how to use the powerful, unique nature of peer recovery support. So as we're talking together over the course of these sessions, we're going to try to be another piece of remedying that situation by really helping you to think about specific strategic targets, things that you can do related to peer support, very specific skills for a specific role, for a specific service, thinking about how peer recovery can be improved, enhanced, adjusted using these tools in a way that is clear, can be communicated, and can be measured, right? We did this adjustment to peer support in this environment, and we can clearly show you what we did, how we adjusted it, and we can show you how it helped. It improved folks' participation or folks' ability to achieve goals or some other measure that is clear, so that we can then say to the bigger systems, this works. This support that we're delivering, this peer service is effective. And we've been able to improve it and make it even more effective. And look, we measured it and it works. So that's kind of our agenda as we're working with you. We like to think about this NIATx model as a way to kind of deliver something to your community. So like moving this stuff into your community, whatever the best practice is, in this case, peer recovery supports, there's a process involved in getting that stuff into your community. And that's where the NIATx stuff comes into play. Those are the tools that we need to use in order to be effective at bringing those supports, those peer supports, to your community at the highest level of quality that we can manage. So that's really what we're going to be about. We would like to take a little bit of time to get a sense of who's here with us. So I'd like to get a chance to gather a little bit of information from any of you who would like to volunteer and just unmute yourselves. You can use the chat too, but I think it's preferable if you can unmute and just speak. We always like to hear your voices. And if you could just say your name, where you're from, what your role is perhaps, and maybe think about sharing one barrier or resistance to change that you've witnessed within your organization as it relates to peer supports. We're not talking about sort of the kind of true confessions tell all, but just something that you've noticed that's a challenge, right? That's a challenge to your implementation of improvement related to peer recovery or peer supports. And if you want to have a little fun on the end, you can also tell us the first concert you ever went to. So that's always kind of fun too, if you want to share that. So we'll just open up the mic, so to speak, and just ask you to share your name, who you are, and tell us about a barrier to change that you've encountered, because we're going to be about improvement, about making changes within your system. So it's important on the front end to think about some of the things that might get in the way of that. So we'll give you a chance to just share an example of those. So who would like to tell us who you are and share a barrier to change that you've encountered?
I will go first.
Go ahead. You go ahead.
My name is Ardella Cottrell, and I'm the co-coordinator of the West Virginia Leadership Academy. We are a program that teaches leadership skills to those in recovery. And one of the barriers I have seen is some people don't realize what they can do until they learn those skills.
Yeah, thank you for that.
My name is Tracy. I work with the Hampton Newport News Community Service Board. I am a registered certified peer recovery specialist too, and I work with people that's in housing. I work in housing, and one of the barriers I see is that a lot of people still don't realize the role that peer support plays, things that we can do and that we don't do.
Yeah, thank you, Tracy. I'm going to keep some notes while you all are talking, and then we'll sort of think about them. So I'll resist the temptation to make some comments because I want to hear from you all. I think Chris does as well. So, but I appreciate what you're saying for sure. And if anybody wants to share their first concert too, feel free. Some people don't like to age themselves, but
My name's Nicole Harrington, and I work at Bridges to Recovery in Wisconsin. And one of the barriers that we've had is showing that peer support specialists and recovery coaches aren't a bad thing. They're not negative for the community. They're actually a good thing for the community. And the first concert I attended was the New Kids on the Block back in the 90s.
All right. Thank you.
I'm Brittany Warren. I work for Life Connections Peer Recovery Center in DeWitt, Iowa. And a barrier I think we have is people not understanding that peer support is a good thing for people. Our community is small. I feel it's a little judgmental. So people are kind of scared to come into the center. And my first concert was Hinder when I was like 16.
All right. Thanks, Brittany.
Here, I'm Jessica. I'll go. I'm Jessica Gugesberg. I work at Fountain Centers in Albert Lee, Minnesota as a peer recovery specialist. One of our biggest struggles right now is just building the program within the organization so that it's not so much clinical based and it's more helping individuals once they're out of here.
Thank you for that.
My name's I'm in England. I'm from Texas, but I'm a recovery coach trainer and we have Recovery Coach Academy. And I think our biggest barrier is the UK is like 15 years behind the US. So for us to try to talk about recovery coaching and peer support and all of this, they're so focused on the professionalism and trying to make like the need for peer support to even be there is really explaining. And so most people here don't know what recovery capital is, you know, all of these things. So we're starting from the very bottom.
I appreciate
my first concert was Ronnie Millsap.
Ronnie Millsap. All right. I know him. I like him. So I will interject. That's why it's really helpful to have a broader perspective, people from different settings. But at the very least, one of the things that we'll do is as per what you just said, you know, it's all relative. You know, we're all struggling with different things. And as you describe it, some of us in the States might be saying, oh, gee, it's so frustrating to get our peer supports moving. And you're saying, oh, you think you've got it bad? You know, you're doing okay. We're even further behind over here because it's just not something that's evolved yet. So yeah, thank you for sharing that. And I say that in a lighthearted way, not to minimize the challenge or the struggle that you're trying to work your way through. I'm saying it to appreciate how you're on the front edge, on the cutting edge of trying to do something special. Thank you. Who's next?
Michelle has her hand raised.
Yes, Michelle.
Great. Yeah, I'm Michelle Williams from Chicago, and I work with NAMI Chicago, you know, and we're an organization that works with people that have mental health conditions, and we try to improve their lifestyle coming from homelessness to housing. And I've recognized, you know, being a certified recovery support specialist, you can see that that's still new for me. I have worked in mental health and substance abuse arena for over 20 years. So for me to take that hat off and just be more of a support for a person, it helps me remember that I'm more of a mentor, sponsor, versus trying to give clinical advice. You know, that's been a barrier for me. I find that sometimes, and it works. I know it works because it worked for me when I was in their role, because I've been there where they're at. When I'm allowed to make choices instead of giving what the counselor think would work for them. You know, so that's been a barrier. Another barrier is I find when people by the time the referrals get to me, they have been through nursing homes, homeless shelters, things of that nature. And they're tired of people kind of in their lives. And they just want to work with maybe one person. If that's the case manager, they've been with them through the whole picture. I think that's, you know, me trying to help them buy in that you still need people in your life. You still need a support network, you know. So I try to enhance that by, you know, taking them places, doing things. If they need to go to a meeting, a doctor appointment, anything, you know, to show them I am not trying to direct them. I am just trying to support them on their journey. And my first, and I know this is going to probably tell everything, my first concert was the Jackson 5. before Michael left.
All right. Excellent. Thank you for that, Michelle.
You're welcome.
Appreciate it.
Yeah, thank you for doing this, Matthew.
Well, for sure.
And Chris, and yeah, we appreciate you guys. Yeah.
Thank you. So who else would like to share their thoughts in terms of your name and what you do, where you're from, and a barrier or resistance to change that you have encountered?
I'm Chris Meekum. I am from Recovery Idaho. We're the organization that provides all the recovery coach training in the state of Idaho. I think around here, the finding funding sources to pay peer recovery coaches in agencies has been the biggest challenge. Although we're starting to see coaches show up in clinical and non-clinical settings, and most recently in several of the drug courts around the state. So that's encouraging. The first concert I ever saw was Maureen McGovern at the Idaho Falls Civic Auditorium. Nice.
Thank you, Chris. Appreciate those thoughts. I see we have a couple of other hands up. Let's go with Johanna. Is it Johanna? Johanna?
Hey, it's Joanna.
Joanna.
Nice to meet you, Matthew. And everyone else. My name is Joanna Dolan. I am on the Peer Recovery Center of Excellence. I'm on Core Team 1. We are about, right this moment, we're about clinical integration, and we're looking to see if there are other things that we need to be at. And I'm also the CEO of Dolan Research International. We train peers and we offer unique coaching experiences for patient education as well. And I think the biggest barrier that I witness when organizations and coalitions are trying to implement change is a lack of shared language. We all have different words for different things, and every time I have a conversation with someone, the first half hour is spent on figuring out, when you say clinical, what is it that you mean? When you say peer support, what is it that you mean? Yeah. And the first concert I ever attended was a Garth Brooks concert when he was still thin and attractive.
We won't tell him you said that.
That's awesome.
All right, thank you for that. We have let's see, a couple of other hand ups. We have Corey, and then after Corey, we'll go to Juan.
Yes, hi, I'm Corey Criddle, and I am from the Peer Connection, formerly known as Favor Grand Strand, out here in the Myrtle Beach, Conway area. I think one of the biggest barriers we have is that a lot of people who are still active kind of look at us like counselors in a sense, and therefore that difference between the two of us, they don't feel like they can trust us quite yet, so it takes us a long time to build that connection with them. And the first concert I ever went to was Travis Tritt.
Travis Tritt. Good. Thank you very much, Corey. And Juan.
Hi, my name is Juan Jordan, Director of Recovery Support Services at Exponents, New York City. One of the barriers that I have seen is a lack of funding for more education for recovery coaches and hire them. A lot of contract is limited. First concert that I saw was the Funny Out Star in Puerto Rico.
Excellent. Thank you for that, Juan. Appreciate that. Who else? Would anyone else like to share your thoughts, who you are, and any barrier or resistance to change that you've noticed? You've heard that we have a couple of key themes, and I'll certainly want to kind of make note of those. I've been sort of listening and noticing those. Who else? Is there anyone else who'd like to share?
Hi, Matt. It's Judy, Northeast Iowa Behavioral Health.
Hi, Judy.
Boy, I get done with one thing with you, and now I got you again.
That's right. Good to see you.
Good to see you. Not as busy as I was a month ago, so that's getting a little bit better. But my name is Judy. I work at Northeast Iowa Behavioral Health in Decorah, Iowa, as a peer support specialist and a peer recovery coach. So I wear a lot of hats. besides those two. Work pretty close with our clinicians in getting, whatever resources they need for their substance use individuals and their mental health individuals. Biggest barrier, I would say, is lack of time. I never have enough time, but that's just my fault, not anyone else's. But otherwise, this area here has been really good with accepting our individuals. So we don't have a lot of stigma based on that. So that's not a problem. That's a good thing.
Mm-hmm. Yeah. Thanks for that, Judy. Appreciate it. And how about Ken?
Hi, everyone. My name is Ken Musgrove. I am the Director of Recovery Support for Community in Crisis, and we're located in Bernardsville, New Jersey, in Somerset County, not too far from New York City. I am also a person in sustained recovery, and I am a certified peer recovery specialist. Probably one of the biggest barriers we have in so many different aspects is stigma. Whether it's folks accessing our services, understanding what we offer, stigma around harm reduction, stigma around Narcan training, stigma around stigma. It's just overlapping. Internal, external, our community, the external community. I am in a relatively affluent demographic where folks don't want to access treatment. They don't want to know folks know that they need services. They don't want to let folks know that they're in recovery. So it's a very insular community, and then insular communities inside of that. But we keep fighting a good fight. So I know I don't look old enough, but I saw Aerosmith and Styx in 1978. Styx was the opening act for Aerosmith. So it was a very there was open air drugs going on in the bathroom, so you can imagine what it was like back then. So it was interesting.
All right, thank you, Ken. Appreciate that. Anyone else who wants to share?
Hi,
I'm Becky. I'm going to start with John Denver, favorite concert.
All right, thank you.
I'm with Hope Chats Community in Green Bay, Wisconsin. We're a drop-in peer recovery center for those dealing with mental health and or substance use challenges. I'm a certified peer specialist and the director here. Part of what I see as an issue, of course, is funding, which leads us to be right now, we're dealing with all volunteers who are working for us and their peers also. And so there's a lack of confidence. There's the confidence is because sometimes they're still stuck in their old patterns, and we're still working on that piece of recovery. And within that, there's that lack of motivation sometimes. So, yeah.
Excellent. Thank you for that. It's very helpful. And I think we heard another voice there who wanted to share.
Hi, I'm Raylan Stans. I'm from Redwood Falls, Minnesota. I own a business that I'm a certified peer recovery specialist, but one of my biggest barriers I find is funding, because I do it privately. And so that's one of the hugest things, is trying to find either a company I can merge with, even just for the recovery coaching, or find a way to privately do it myself. And, most insurance companies, they are just starting to learn what that is and how to fund it. So here in Minnesota, it's taking a little longer for some of that stuff to happen. And my first concert was Indigenous in like 1995. So.
All right. Thank you, Raylene. All right. Any other parties who would like to share their thoughts about or barriers to change? One of the things that I note when we got started is we didn't have to do much in the way of prompting to encourage folks to share, which I really appreciate. And we just had a bunch of folks share a wide array of things. And so I thank you for that. If anybody else would like to share, feel free, and or you can also share in the chat now or at any other point as we're having our conversations. We'd like to hear from you and have a dialogue with you as we move forward. So thank you for sharing that. Hey, Chris, what was your first concert?
Oh, me?
Yeah, I forgot.
I saw the Madonna, her Like a Virgin tour.
Nice.
Yeah.
I think mine was Journey. My first big concert was Journey. I think it was like it was either 1980. I think it was 1980. Yeah, I think that's right. Yeah, that was a big deal.
Yeah. Yeah.
All right. So thank you all for sharing. A couple of themes to these barriers that I'm hearing. Clearly, you heard a lot of folks talking about stigma challenges, right? People not understanding what peer supports are and or being judgmental of what peer supports are, or having preconceived notions about them without really understanding them. So struggling through stigma in all the systems that you work in. So many of you talked about that. And I think that theme around language and just someone did say there was a lack of shared language. How do you communicate effectively what you do to other systems or parts of systems that don't understand what you do, or may have maybe have a prejudice, a preconceived judgment about what peer supports are and about their value. And so one of the things that I think we'll be doing as we look to explore some of these process improvement tools is to help to do improvements that are simple and clear, that can be communicated effectively. And my hope is that when you do improvement projects and you can share them more broadly and tell a story about how you improved peer support in a measurable way, that you can impact some of that stigma, that you can give some folks a clear understanding of the benefit that you provide to your communities, and that you can show them how you're enhancing that service and that support across time. So I think that's a big part of what we can try to focus on. Also, a lot of you talking about the barrier of funding, the barrier of resources, and how often there is limited staffing, limited funding, limited opportunities. And again, I think if we are successful in being able to do improvements, implement changes, show that they work, we are then able to show the value of peer supports. And if we can show that value, it helps you in your advocacy efforts. So instead of us saying, take our word for it, we know it's helpful, we've seen a lot of people improve, that's valuable. And telling stories about individuals' improvements is very valuable. And if we can add to that, and oh, by the way, we did this particular project and we measured something and we see that it created this kind of an improvement, that is another layer of powerful messaging that you can use to advocate for continued growth in resources and funding, reimbursement for peer support. So, because I know a lot of you are on the front lines of that advocacy. And so we heard that. Any other themes that you heard, Chris, or others might want to note in terms of what we heard as people were sharing related to those barriers?
I think you captured everything there really well, Matt.
Okay, thank you. Yeah, so thank you all for sharing. I appreciate that. So we have these barriers to change. There are, as we described, a few that are key to your work. There are others, of course. These barriers get in the way of a lot of what we do. If we did some analysis, which has been done around initiatives, change initiatives that people engage in, we know that these barriers get in the way and that often we're not successful. So there's a big X next to that percentage. The bad news of what percentages of change initiatives that fail. What do you think might be the percentage of change initiatives, based on some research that was done, that are not successful, that fail to achieve the change that they sought to achieve? Somebody just throw out a number, say it out loud, or you can put it in the chat, whichever. What do you think the percentage is? Percent that fail. What do you think?
100% of those that aren't tried.
95, 85, 70. 70, 85. Okay. Well, so the actual number that we have is 70. So Joanna wins the prize. And, you know, there's some really hard-nosed realists in this crowd who said 85 and 90. Sometimes they have optimistic crowds who say 20 or 30%, but you all are in the trench in terms of knowing how these things are a struggle and are a challenge. So I appreciate your, and I love what Ken said, 100% of those not tried. So thank you for that. Absolutely, for sure. So yeah, there's most of the things that we implement as changes, personally, organizationally, are not successful. You know, we try to do a lot of things that we don't manage to sustain in our change efforts. So I want to talk with you on the front end of this work together about some of the reasons why that is the case. So we'll think about barriers in a couple of different categories. One is the organizational level. So organizations don't tend to focus really well sometimes. They don't focus on the specific effort. And so if they don't have clear priorities from leadership and management, it becomes very difficult to put enough resource to the change. Some of you were talking about the lack of resources. And then if we don't focus our effort, and when we have limited resources, we tend to have very limited influence or power, because we've watered down our resource to a level that makes it almost impossible to implement something. So that's a really key issue, is trying to focus on the critical priorities. Lately, I've been talking about this idea that the word priority didn't used to be a plural word. You know, if you went back 100 years ago, no one said priorities, S on the end. They just said priority. It wasn't a plural word. We've made it into a plural word, which is kind of problematic, because now we start to think that we can have 17 priorities, but we really can't. And so that means hard choices. And sometimes organizations struggle to make hard choices. We really can't put a lot of energy into 17 different things. It's just too many things. How do we really be decisive about those things that are most critical to us, and then put our energy into those things? Sometimes we have conflicting messages from our organization about prioritizing or saying something's important, but then do we really value it? Do we give it the resource that it needs, and the support and the nurturing that it needs in order to be successful? And sometimes we don't have clear objectives. What is it that we're trying to do? How are we trying to impact our community? What supports are we trying to, what goals are we trying to achieve? So those are on the organizational side, but then we have some on the individual side. One of the challenges to change is status quo bias, which you may be familiar with. It's this idea that all things being equal, people tend to like to keep things the way they are. If it's not broke, don't fix it, leave it alone. And so that tends to keep us in the same position. And you all were talking about delivering services that require systems to change. In order for your peer support services to be effective, the systems around them have to embrace them and adjust and change and make room for them. Room has to be made for them to coordinate and partner with the other supports, et cetera. And so if you're stuck in that status quo thinking, it's hard to make those changes occur if people in their individual orientations don't see the value of that change. Also, loss aversion. When people are trying something new, there is a worry that they will lose what they have. People get concerned that that they want to hold on to their current resource, their current benefits, their current opportunities, and change creates risk, a perceived risk that something might be lost if we make a change. I might not be crazy about what I have right now, but if I try to make a change, it might be worse. That's kind of the worry that folks have in terms of taking risk and trying to do something different. So those are a few of the ideas, and I think they're embedded in a lot of the comments that you all were sharing just a bit ago in terms of these barriers to change. So what do we do with that situation in terms of trying to address some of these barriers? How do we overcome them? And that's where we use our NIATx model that we're going to be sharing with you over the next several sessions. And this is a simple version of it. You can actually go to YouTube and search for NIATx on a napkin, and you'll see a short video that's really helpful to explain the core elements of this NIATx model. So this is what it looks like. Oops, got a little formatting problem on this slide. Sorry about that. I'll have to fix that. Another process improvement for us to work on. So the idea, I'm going to flip back to this one because it's a little easier, is this simple napkin model here, where we look to focus on a particular aim, the thing we're trying to change. And we do that by developing a change project. And we have a series of simple tools that we like to use. To the right, you see those 4 tools, and we're going to teach you all 4 of those. Teach you about a walkthrough, which is a role play to learn about what might need improvement. Flow charting, which is a way of mapping out the process that you experience when you do a walkthrough. And then nominal group technique, which is brainstorming, which will help us to come up with a solution or a strategy to address some of the things that we noticed we might be able to improve when we did the walkthrough and the flow chart. And then we do a PDSA, which stands for Plan, Do, Study, Act, cycle change, rapid cycle change, where we do an experiment to see if we can implement a change and measure it and see if it works. So we're going to work our way over the next sessions through those tools. We'll also talk about the roles that we have in these projects. We have, to the left, you'll see executive sponsorship, where we have executive leaders who support these projects. We have change leaders, who are the people who implement the changes, and they do that as part of a change team with a few other people who can help them. And we have just a couple of simple rules. We try to not add burden to the system with any additional resource requirements. Try to use existing resources. It's always important that we measure the change and that we work on sustainability, that we try to figure out how we can sustain it. So that's pretty much the NIATx process improvement model in a nutshell, or on a napkin. And we're going to dig in deeply on all of those elements that you see there. So if you want to learn more about this process, above and beyond what we explore here, I encourage you to check out the website, www.niatx.net, which can give you the opportunity to read a lot about different projects, the various tools that we'll be discussing, various other resources. And through the history of NIATx, we've been collecting information about different projects that people have done. So it's a nice place to gain some additional insight and awareness about this model. Let me stop there for a second, see if anybody has any questions or comments about any of the things that I've been sharing with you by way of introduction to what we're going to be doing. Thanks for the link in the chat. Appreciate that, Chris.
I just wanted to pause and remind everybody that we do have we created a specific landing page for this Change Leader Academy, where we have links to the handouts and resources, links to the NIATx on a napkin, the NIATx website, and then we'll also post today's recording on that page as well. And throughout today's training, I'll just keep putting that link into the chat so that people get familiar with that space. And then Joanna has a question.
Yes.
Hey, thank you. And thank you for posting all the links. Super helpful. I got a question on the video. So I watched it this morning and it directed you to another video on your website, but I didn't find that video. Is there another video? How do I find that?
That's a good question, and I haven't looked at it in a while, and I'm not sure what that link is. Chris, do you know the answer to that? Have you seen that?
I don't, but we'll figure it out, and I know how to get a hold of Joanna, so I'll let her know whatever, and then bring that to our next session.
Yeah, we'll check it out
Thank
and
you.
see. Yeah, there are some other resources, so maybe it's linking to something, and there's some link issue, or it's not working for you. So we'll check it out for you. Anybody else? Are we good? All right. Well, let me talk a little bit about the quick history of where this stuff comes from. Okay. So this is W. Edwards Deming, who is a data scientist who is kind of one of the foundational thinkers in quality improvement, process improvement, was super influential in the 40s and 50s, a lot of post-World War II industrial change and development in this country, in Japan, post-World War II, redevelopment of the Japanese manufacturing infrastructure, which of course we know was incredibly successful. And Japan rebounded after the war and achieved some pretty amazing improvements and quality of their manufacturing industry in a relatively short period of time. And that was through the help of some folks like Deming, who was able to be kind of like an inventor of the whole model of process improvement. So a few key concepts here that came from Deming. Everything is a process. All work is a process. We can break down everything that you do into a series of steps, a series of actions, and think about it as that series, as that process. Sometimes I use examples of assembly lines where we're thinking about manufacturing and something's being built on an assembly line. It's a nice way to visualize process. And everything that you do in your work has the same potential components. Now they might be more relational or interactive, but we could put them on an assembly line sequence and say, first we do this, and then we do this, and then we do this. And they may vary based on some variables, but there are identifiable sequences to every part of work. And most of the problems that customers have are due to poor processes and not people. Think about the complaints that you get from the folks who you serve. It's almost never about the quality of your intervention or your utilization of a best practice model. It's usually about something like, I don't like to have to fill out this long form, or I thought you were going to call me and you didn't call me, or I don't understand how to access this service that you referred me to because it's confusing. These are mostly the things that cause folks to become frustrated and to have maybe a negative experience with a service. And so if we want to fix those problems, we have to focus on improving the process, right? And we need to have data to guide us. So this model is data driven, and we'll talk some more about that. What kinds of data and information do we have that we can use to guide our improvement efforts? And importantly, we have to know our customers, and we have to involve the frontline workers. So these are all the core foundational principles of process improvement that come, as I said, from that more manufacturing industrial perspective. So when NIATx was developed, the two folks at the ground floor were Dave Gustafson and Todd Mulfenter, both of whom are still active and involved in leadership with NIATx. And so they did some work to try to think about applying this knowledge, this wisdom from process improvement, and to do an analysis about organizations that are good at change, and to think about what they do differently when compared to organizations who are not so good at change. So they looked at 640 organizations across 13 different industries, and they examined a total of 80 different factors, and they came up with 5 key factors as the most powerful factors that influenced an organization's capacity to effectively engage in change. And these 5 factors became our 5 NIATx principles. So we have these 5 principles based upon this work. So I'm going to work through them with you and give you a quick tour of those 5 factors. So number 1, understand and involve the customer. You usually don't have to do too much effort to convince people in peer recovery or peer support that it's important to understand and involve the customer, because that's at the heartbeat of what you do. I will tell you that in some other environments, I do have to spend a little bit of time reminding people how important it is that we listen to the customer. And by customer, we're using that term very generically, whoever it is that's receiving the service or the support that is being delivered by someone. Could be peer, could be client, could be participant, whatever it is that you might think of in terms of the language that works for you. So if you think about your own environments, who I have a question for you. Who do you think is your customer? And let me ask you, what do you think about that language, customer? How does that strike you when we use this term customer? Any thoughts about that? Some people aren't crazy about that language of customer, but other folks are think it works. Would anybody have any reaction to it?
Matthew, I was going to say that if I'm talking in the general form, I think my participants, my members would prefer customer as well, as form as just, keeping it incognito or just keeping them generalized instead of personalizing their situation.
Sure. Yeah, that makes sense. Yeah, thanks for that. Did someone else have a comment?
I'm not a big fan of customer nor consumer. I think participant speaks more toward engagement and ownership, and they're part of the process.
Yeah. No, I appreciate that. See, we had another comment. It's someone uses member. Someone likes think about what's less stigmatizing, maybe liking this language. Again, it's whatever language works for you. As we said, culture, stigma, language evolves, and we have to kind of keep up and be mindful of different perceptions around language. We talked about person first language and non-stigmatizing language. So I always like to take a pause when we talk about this to sort of remind ourselves of that concern. So for whoever, however it works for you to think about, this is this notion of having that party who we're serving, who we're supporting, who we're working with, being at the center of what it is that we're doing. So the second key principle is fix key problems that keep the CEO awake at night. So what are the things that leadership is concerned about? That's not to say that we should only be concerned about the things that leadership is concerned about. We might have a different set of priorities, but if we want to have a strong support from leadership, we want to make sure that they understand our concern and that they value it and that they know that it's important. So if they already think it's really important, then great, they'll be behind it and they'll be helping us. If they don't, we better figure out how to get it on their radar. Otherwise, they're not likely to be supportive of what it is that we care about. So kind of thinking about it from both of those angles, we have to make sure that our leadership is on board and that we're fixing problems that they care about. So, and as I said, if they don't care about them, we better figure out how to get them to care about them, or we maybe have to rethink it. Is it, what is our priority? Do we have to try to think about maybe doing something else if we're not going to be able to get leadership to support this idea? Maybe we have to shift it a little bit. So that's,
Matt,
yes, go ahead, Chris.
I just wanted to jump in because Joanna pointed to this as well earlier, but I think too, first, we're not advocating that you call the participants, members, guests, customer, but we will use that term in this training because it's all encompassing. And oftentimes, like Joanna stated, we have multiple customers. So I heard quite a few people reference, sustainability and funding factors. And so if we really think about that, sometimes our customer is the person we're creating a contract with. Sometimes our customer is our single state agency or our Department of Human Services or Department of Health. Sometimes our customer, especially in providing peer support, might be a residential treatment center or maybe a library or a system that wants to integrate peer supports. And a customer might be networks of professionals that come to us to learn about peer recovery support services and what are they and how do I do it and how do I write a position description and how do I integrate them into my team. And so I think for this training, what I like about use of that word is we can apply the NIATx process to all of those different customer bases, if that makes sense.
No, it does make good sense. Thanks for articulating that, Chris. And the thing that this sort of reinforces the idea that we're coming at this from some other roots in other industries, in other fields. And that's where that kind of customer service language comes from. And it gets us to think about this a little differently. How do we serve those folks effectively? I like the fact that, I think that I do this work with a lot of different groups. And when we are talking about folks who are doing peer recovery support, there is always more conversation about the language. And I think that that's a good thing. And I think that's because you all have maybe the most acute awareness of how language can be used to help, or how it can be used to harm. And so your insights into language are probably a little more refined than some of the other groups I talk with. A lot of groups just say, okay, customer, whatever, I don't care. Whereas you all have a desire to really kind of focus in on that in a way I think that's helpful. I think it helps us all to keep learning and thinking about it. So that's a good focus that I appreciate. So again, as we keep moving forward, think about that customer idea and see how it works for you, and keep the conversation going about that. So I appreciate your vision on that. So number third of our 5 key principles, pick a powerful change leader. We want to find someone who's going to lead our change project, who has some power. Now, power is not just organizational formal power, like being a boss or a supervisor or something like that. It can also be informal power, someone who happens to have influence because of their personality or their role or their relationships or whatever it might be that gives them influence. It's important that we have someone who's in charge of the change project from a facilitator kind of a role, who has some influence, who's kind of connected to the senior management and can talk to the director, is a voice that's trusted, that people can hear and listen to. So, and is able to facilitate a meeting and kind of get a team together and help a team to complete a project. So that's an important piece. And then the 4th of our 5 principles is getting ideas from outside the organization or field. This relates to some of those language issues we were just talking about, like thinking about customer service from the perspective of, I don't know, your bank. Recently, I went to my bank and I had to do something at the bank, and I had sort of a weird customer service experience. And I was sort of thinking about, like, how could they do that differently? Or how does that relate to the kind of stuff that I do? We all have these customer service experiences all the time, right? Wherever we go. I was at a pharmacy getting a prescription recently, and this woman was at the window ahead of me, and all of a sudden she started yelling, and everyone started, got very nervous and quiet. And then I realized as she was talking that the whole process had been terrible for her, and that someone at home was very sick, and there'd been a problem with the prescription, and it wasn't filled and wasn't ready, and she just became really upset. So it kind of gave me this little insight into the pharmacy process and how it clearly didn't serve her well, and that's why she was so upset. So how do we get ideas from what we see out there in terms of problems that we want to avoid, or amazing service, like when you go into a restaurant and you're really welcomed, and they know how to kind of guide you through the process to your table, or at a hotel, if you go to a hotel, and how they maybe provide you certain supports when you're checking in, whatever it is. How could we improve our customer service when we first join or meet with people, so that it's similar to some of those environments that are really good at that stuff, that really make people feel special when they first have contact with that organization or that business. So ideas from outside can be really, really powerful and helpful. And the last one of the 5, using rapid cycle testing to establish effective changes. So using this PDSA model, the organizations that do effective change use some version of a rapid cycle testing model. So those are the 5, and there you see them on the sheet. I'd like to have you answer this question. Which of those do you think is the most influential? Now, these are 5. These are the top 5 out of 80. So these are already the top most powerful elements in terms of those organizations that are most effective at change. They are all good at these things. So this is already the top of the deck, but there's one that stands at the very top out of these top 5. And I'm wondering which one you think it is. So go ahead. I see some people are already chatting some numbers. You can say one out loud if you want. So I'm seeing 3s and 2s. A couple of people saying number 1, number 4, number 2, number 1. So, all right. So we have a range of ideas, 3s. Looks like 3s and 1s are kind of pretty popular as I'm seeing the answers. So let me share, let me reveal the number 1 is number 1. Understanding and involving that customer if we are really focused on the needs of the individual, right? That really is at the essence of organizations that can make changes effectively. And the second most powerful one, number 4, getting ideas from outside the field. That one usually gets kind of underrated when we think about organizations and what we do. I think that often the human service sector has never really had much of a chance to explore ideas from outside. We haven't really done that a lot. So most of our systems are not really tuned into that. We don't think about, how could I learn from the grocery store how to do better customer service in my human service agency or my peer support program? Well, the initial reaction is there's nothing I can learn from the grocery store. Well, wait a minute. There might be some things that they do that are kind of interesting in terms of how they support their customers or how they interact with them or how they use their resources. That's a classic example we sometimes use. Like, when you go to the grocery store, there's never the same amount of people at the checkout lines at 11 o'clock in the morning as there are at 4:30 or 5 o'clock in the afternoon, obviously, because that's when they're going to get a rush of customers. Well, we say obviously because that's what we know that they'll be doing because they've figured that out. But in a lot of our human service environments, we don't necessarily make those adjustments of resources across the calendar in terms of demand on the system. We tend to make folks wait longer when things are at those busier times rather than moving our resources around. So that's just a simple example of something that you can learn from that environment. So let me pause for a minute and ask you what thoughts you have about these principles and about any of the things we've been talking about so far. I'll share another little bit here in just a minute, but we've got a little bit of time. I want to sort of pause and get some reflections from you about these ideas, these principles that we've been discussing, because these are kind of the foundation of this model. So I want to give you a chance to respond to them.
I really appreciate number 4 in all of this. Getting ideas from outside the organization or the field itself. And I really appreciate that. I was thinking about Bob Chapman, if you've ever heard of him. He's this huge I don't know. I would go with process improvement guru. He has taken small businesses that were just totally flailing and totally turned them around. And the biggest way he has done that is through this whole communication process. And I feel like that's a really important thing to look at when we're looking at different getting ideas outside of the organization. That's something I would like to do.
Sure. And when we think about, as Chris was saying, how we have different customers, some of them are external, but some of them are internal. How do we make sure that we have excellent communications, that we listen to people, that we give folks opportunities to share, that we build trust so that folks are comfortable sharing, that they know that they'll be heard and respected if they share. There's a lot of systems where they don't have that kind of a culture. They haven't built that sort of a culture. And then they ask questions and say, does anyone have any opinions about this? And no one says anything. And then the folks who asked the question said, well, I guess they don't care, or I guess they're not interested, or I guess they're they're just going to leave it to us to make the decision, which further reinforces that model, which is a top-down model, right? So the assumption is that, well, folks aren't participating because they don't want to. Well, have you created an environment that encourages, enables, supports that sharing? If you do, people share. If you don't, they don't. So yeah, how do we create that kind of a honoring of people's voices? And you all, I think, are all about that. What the work that you're doing is all about that. So you have a awareness about that others might not have. And that's one of the critical values from my perspective of peer support, is that particular value. Thank you for that. What else are people thinking about as we talk about these principles?
And I always think about when I had a medical procedure done, different from my mental health or substance use challenges. It was like a whole new experience for me, meaning so opposite end of the spectrum, where, you know, I had this procedure done, and then upon leaving that, they're like, okay, we're going to see you once every 3 months for 2 years, and we're going to check in with you about this. And it was seemingly like all kind of done and wrapped up, but they wanted to stay in connection with me to see if, you know, something flared up, they could tackle it a lot sooner. And then, having been through treatment episodes 4 different times myself, it was like, oh my gosh, like never once when I left a treatment episode did anyone say, we're going to schedule right now 2 years worth of follow-ups and do recovery checkups every 3 months with you. And I think how transformational that would be for the mental health and substance use fields if we adopted some of those things from other areas of healthcare. And make that the expectation too with the customer, and not really think about, we see too many like graduations, like you're graduating, and what does that even mean? And it kind of gives the false pretense that we're done working on this. And as we know, these are lifetime, I won't even want to call it challenges. Sometimes it's a lifetime gift that you get to work on this for the rest of your life. But definitely to take a look at those areas.
Those are really good points, Chris. Yeah, because our actions don't match our values or our language. You know, we go talking about how recovery, it's, you know, it's a marathon, it's not a sprint, it's a lifelong pursuit, it's an ongoing activity. And then we have systems like what you described, which are the called a sprint orientation. Okay, you know, you do this thing and then complete this thing, and then how much do we may say to people, yeah, keep doing some stuff that's designed to sustain your recovery, but are we involved with that, or do we just not really? We just say, okay, go do your thing. I mean, this is sort of a traditional model that we have. I think systems are getting better at that, but they're still not very good at it. Like you said, so you had that health system which said, no, of course we're going to keep talking to you. We want to make sure that we're preventive of any kinds of reoccurrence of issues, or that we're keeping a mindful eye on your healing process, or, you know, however it's described. Of course, that's what we're doing. Why wouldn't we do that? Yeah. And so why is it that our systems haven't done that well? So that's a really good example of an outside of the field perspective. Any other thoughts that people might have about the whole keep fixing the key problems that keep the executive director awake at night, or understanding the customer, or change leader, picking a powerful change leader? We'll talk about the PDSA stuff, of course, as we get into that. But any other reactions or reflections on those ideas? Okay, I'm going to share with you sort of a little fun exercise here that we can do together, which will help us to think about this idea of sort of looking outside of the normal box of how we see things. So here's a picture. I want to do a fun little exercise with you here. So here is a picture, and you see this element in the center here, and I'm trying to find out. I want you to look at this, and I want you to count the number of squares that you see in the center of this slide. So take a few minutes, count the number of squares that you see. Don't share it with anybody yet. Don't chat it. Just take a minute and count how many squares you see there. Okay, so once you've done your square counting, I want you to share in the chat the number of squares that you counted. All right. All right, so check out those numbers if everybody's looking at them. There's a wide array of numbers: 25, 16, 26, 30, 21, 26, 25, 34, 26, pretty common, 30. All right, so lots of different numbers, a few different numbers. It's clear that folks are seeing some different ideas about these squares. Those of you who may have said, I see 16 squares, are saying, what do you mean 20 or 30 squares? What's going on here? All right, so let's walk our way through what we have here, okay? So let's think about this picture. So 16 squares would be four up, 4 down. So if we count up all these individual squares, these black squares, we would have 16, 4 times 4, right? 4 by 4. That's what we have. So that's the 16 number that some folks were seeing. Absolutely. That's often the first analysis, and that's what a lot of us come up with. So the whole idea of doing this work and doing this process improvement work is that we want to keep looking deeper and keep going further as we explore the details of what's happening or what's going on here. So some of you, as you looked at this, started to see some other things going on here, right? Because there's not only these 1 by 1 squares, there's also 2 by 2 squares, right? So each corner and so there's like 3 rows of 2 by 2 squares, and then 3 of them across the grid here. So there's 9 of those, right? Top to the left, top to the middle, top to the right, in the center, left, middle, right, and in the bottom, left, middle, and right. So that's 9 of those, right? So that gets us to 25. But we're not done yet. Whoops, skipped. Oh, I lost the slide somehow. That's weird. Huh. I'll have to check that out. All right, so I'm missing a slide. I'll have to just say that out loud to you. 3 by 3 is also here. So if we look at the top corner and count down by 3 and across by 3, that's also a 3 by 3 square, right? So there's one of those in each of the corners. So there's 4 more of those. And then there's, of course, the biggest square in the center, which is all of them, 4 by 4. So that comes up with a total of 30. And I think somebody said 30 as well, which is cool. Kudos to you all if you did, and kudos to you, any of you, for kind of digging in deeper and thinking about the bigger picture here, because that kind of reflects what we're trying to do as we move this process forward. So I'm going to take us out of our slides here for a minute and think with you. Excuse me, I just have to minimize something. And kind of wrap us up here together. We have a few more minutes, but to wrap us up, we may end up a couple of minutes early, and see if we have any questions as we think about next time. We'll be meeting again next week, same time, where we'll start digging in on some of the content, talking about some of these roles and some of the tools that we'll be wanting to encourage you to do. One of the things we sometimes ask folks to do if they're going to dig in and kind of look at some of the materials, as Chris said, she provided the link to look at the materials. we're going to talk about the walkthrough. And so if anybody's interested in checking out that material and reading about the walkthrough and wants to kind of get a jump on things and try one in terms of role play or experiencing the process through the eyes of the folks who are your members, your consumers, your clients, your customers, you can go ahead and do that, but absolutely not necessary, because that's sort of getting a jump on things, because we'll be talking about it and helping you to think about that. So Chris, do you have thoughts in terms of next steps or as we wind down for today?
No, I'll repost the link in the chat. I would say just to go to that landing page and really like watch the NIATx on a napkin, and then download some of the handouts that talk about the principles, and we'll go deeper into those principles moving forward and really talk about how to implement this process, but just become really familiar with the terms. And for myself, when I first learned about NIATx, it was like, what? Like, I'm not quite sure about this. But I was able to apply it in an intensive outpatient setting in integrating peers. And so hopefully we make it very tangible and concrete for you in the upcoming session. So I can use real world practice of this model applied in an intensive outpatient setting, providing peer supports and seeing where they worked best. But yeah, just kind of ruminate on the materials and then come to our next session ready to kind of think of specific areas or your organization and how you'd like to set up a change project and what that might look like.
Yeah, that's really good advice, Chris. I think folks get the most out of this training if they are thinking about a specific improvement that they would like to make in their own environment and trying to apply the tools as we describe them, as you learn them, to whatever that effort is. And certainly that may change across time, or you may decide not to do whatever it is you use as your model for thinking about it, but it really is the best way to learn, to just try to apply this to a real challenge, a real problem, a real struggle that you're trying to think about, something you're trying to improve within the services that the supports that you provide. So yeah, I think that's good advice. Any questions or thoughts today? As I want to leave a little space if anyone has any questions about next steps or about anything we've talked about. All right, well, not hearing any, I think we'll go ahead and wrap up a little bit early, which is good for you all to grab a few little extra minutes here in the day. And I thank you again for your sharing, the open expression of your thoughts and reflections on the material. We'll continue to ask you to do that through the coming sessions, and that allows us to really do well and learn from you. It should be a dialogue, and so we want to keep your voices in the mix all the way through. So please do to share your ideas as we continue. So